I want to talk a bit about if you're a parent or a caregiver who is raising a person with autism or suspected autism spectrum disorder or fetal alcohol spectrum disorder. And because a lot of times parents will say, it's hard for me to tell the difference. We go online and we see these charts with these overlapping symptoms, sharing things like executive functioning disorders, memory issues, especially sensory. We'll see a lot of that. And so, how do you tell the difference between the two? And I just want to preface and say I'm not a psychologist, I'm not a clinician, so I can't give any sort of medical advice, but I'm just sharing what I've experienced and what I've read. With autism spectrum disorder, it's much more straightforward in terms of the predictability of how these things manifest. And we have a lot of documentation, right? We have a lot of work has gone into providing services and therapies and understanding how the autistic brain works. So there's a certain predictability to it. Over time, if you see that your child is having a sensory issue or some sort of meltdown, you can learn their triggers. And it's very predictable. You know that, okay, look, we're going to avoid these socks. We're not going to try wearing this particular pair of socks, and we'll wear whatever or go barefoot. Whatever, you know what I mean. With FASD, it is much more unpredictable because that is the result of alcohol and brain damage, essentially, and throughout the whole body. It makes the symptoms come out very much more erratic, much more unpredictable. And so that will, when you see behaviors or things that come kind of when you feel like out of the blue, and it went from 0 to 60, and you have no clue how, it's more likely that it is fetal alcohol spectrum disorder rather than autism spectrum disorder. And the core, the difference, I guess, the core difference with FASD is that a lot of the issues are a result of anxiety. There's a lot of anxiety because there's a lot of confusion about understanding the world and how they're perceiving the world. And also because of that unpredictability of it. Sometimes they wake up and they're feeling good and they're feeling like they're in control, and other days it's like gone, anxiety's through the roof. And so to uh, reduce those symptoms, unlike with autism, where you're going to learn that person and you're going to find supports and they're going to react in a predictable manner and you can calm them down in that way, with FASD, you're going to work on eliminating or reducing the root anxiety that they have. And so go straight to the addressing the anxiety and realizing that the reaction that you're having is a result of anxiety. And so if you're able to reduce that, we reduce those symptoms and help them deal with that unpredictable brain.